Okay, today I want to talk about the transverse abdominis muscle. The transverse abdominis muscle is one of your deep core stabilizers. It runs from here to here in your back, and then it wraps around the front. So it's literally like an internal corset. The front fibers connect to the linea alba, which is a piece of fascia that comes from your sternum, and it goes down to the pubic bone. Some people are familiar with this if they've been pregnant or if they have had a hernia or have some kind of diastasis recti. This is an important part of the body that the transverse abdominis connects to. It also connects to the thoracolumbar fascia at the back, but it is your internal corset, and your transverse abdominis is one of your deep core stabilizers. That's one of 4 muscles. So this is the side walls of that canister. The top is the respiratory diaphragm that helps you breathe. The bottom is the pelvic floor, or are the pelvic floor muscles. And then the 4th one are these little teeny tiny muscles that go up your back. They're kind of like little braids along your spine, and those are called the multifidi. Now, the importance of these muscles is that they pre-contract prior to you doing any big movement. And that is if they are healthy. So, for example, if you have injured yourself or you have back pain, the transverse abdominis might take a deep break. Or if you've been pregnant, then those muscles have been stretched out and they might, you might just want to kind of give them a little nudge in the right direction. But the point is that these deep core stabilizers, the transverse abdominis, the respiratory diaphragm, the pelvic floor, they are constantly managing pressure within your body. And pressure is really important because if I were to go to stand, then that's going to change what the orientation of the pressure that's happening within my body is important. You know about this if you've heard about stress urinary incontinence, prolapse, diastasis recti. Those are all pressure management issues. So this transverse abdominis muscle is very important, and I'm going to go over how to work on that today. So let me orient my camera down at the floor, and I'm going to show you what it looks like when I do a head lift and I don't engage my transverse abdominis. Okay, do you see some doming happening here? Do you see a lower abdominal pooch? I haven't engaged my transverse abdominis and it makes it really hard to lift up my head. Okay, so if I engage my transverse abdominis, then in my mind's eye, I do it with my mind's eye, I think about headlights coming off of my hip bones, shining up at the ceiling, and in my mind's eye, I point them towards each other. Now let me show you what happens when I lift my head. It stays flat. Yay! Okay, so when I did that, I also felt a little bit of a pelvic floor muscle contraction because they share fascia. So you have fascia that it's a part of this canister that goes down through the pelvic floor, up the back, over the respiratory diaphragm, and back down again. And it's holding all of your abdominal contents in there. So if you get a little pre-contraction of the pelvic floor, that's okay. Those two like to work together in tandem. In fact, if you tend to have lower abdominal pooching and a weaker pelvic floor, then you may practice, go ahead and do this with me. Place your fingers on the inside of your hip bones where you may feel the transverse abdominis. You don't have to push hard. Now go ahead and do a pelvic floor muscle contraction and see if you can feel the transverse abdominis firing at the top. All right, it's okay if you don't know how to do a pelvic floor muscle contraction. That's another video. But now I want to address something because the transverse abdominis is the deepest of our abdominal muscles. The one that sits on top of that is the internal oblique muscle that comes around like this. Then we have the external oblique that comes down and in like this. That muscle helps us kind of curl up. Okay, I'm really engaging that external oblique muscle on this side. And then we have the rectus muscles that help me flex my spine. Okay, now sometimes people will cue to pull the belly button towards the spine to get the transverse abdominis. Now you are, but you're also overdoing it and you're getting internal oblique. Okay, so what can happen if you over engage into the internal obliques is that you may start to get a cinching effect through the abdomen. And we really want balanced muscles for pressure management. So if you're internal oblique dominant, then you may create a cinching effect here and feel more pressure down here, okay? So if that's the case, I really want you to back off. Think about doing a little pelvic floor muscle contraction, pointing those headlights towards each other. You're not going to get internal obliques, and that's just sharing the load a lot more rather than trying to get internal oblique to do that for you. Okay? Because remember those deep core stabilizers, we're trying to turn those on. Okay? Now you can check that if you're internal oblique dominant. Okay? When you pull the belly button towards the spine, I just felt my ribs widen. Okay? So you can get the angle of your ribs from the sternal notch down, and you can kind of see what that feels like. And when I just engaged internal oblique, I pulled my ribs wider. You may also feel a popping out happening at the abdomen. I can also feel my SI starting, sacroiliac joint starting to hurt. So like really, you don't need to overdo things, right? You don't. We're just trying to train that little pre-contraction to come back. You may feel a little pelvic floor, right? And we're trying to get even abdominal activation. Okay, so if you feel your ribs widen, you look like you have a cinching effect happening at the waist, then we need to back off that internal oblique so that we can get better pressure management. Now, another thing that tends to happen is that sometimes people have dominant external obliques, okay, where their ribs oftentimes are cinched in, and that, you know, maybe not quite 90-degree angle becomes narrower. And that can happen a lot with upper abdominal gripping. And just by doing that, do you see how my lower abdomen pooched? So if that's the case, we want to relax the external obliques and the transverse abdominis at the top, okay? And we want to focus on getting a more even contraction, maybe by doing a little bit more of a pelvic floor muscle contraction and engaging those lower abdominal muscles to get everything to be more even. Okay, so I want you to play with this transverse abdominis contraction. If you're still having trouble there, or if you're like, surely that little flicker of a muscle can't be doing anything, then I want you to come into a quadruped position, because we call this a closed chain position. Okay. When we're stabilized. Now watch this. I'm gonna let my belly go. Okay. All right. Now I'm gonna point my headlights towards each other, and I can breathe through it. I can speak through it, and I can let it go. So literally, I'm thinking about pointing headlights towards each other. Now I can get a little bit of a pelvic floor muscle contraction in there with it, and watch that, okay? So don't overdo this. Play with a transverse abdominis contraction on your back. See if you can feel that little flicker of activation on the insides of your hip bones. If you really doubt yourself, you can come up to the ribs and do a little transverse abdominis contraction, and you can feel it here. See if you tend to, when you sit up, have too much rectus engagement. Too much internal oblique engagement, which will be that cinching, you'll feel your ribs pulling apart, or you have lower abdominal pooching, and we'll try to even that out, okay? So again, let me just show you that contraction with a head lift and no transverse abdominis, okay? Watch this. Look at all that rectus dominance, right? Like I'm loosey-goosey on the sides here. Now, headlights, and I come up and it's way more even. So practice that, because this is incredibly important when it comes to back pain, prolapse, incontinence of any kind. And it's just really important to know how to engage your transverse abdominis, and then practice it with going from sit to stand. What does it feel like to go from sit to stand without TA and then engage TA, or lift an object without it and then with? It'll feel lighter. You'll notice that you have more stabilization through your body. Thank you so much for learning how to engage transverse abdominis with me, and happy practicing.